This is your PANCE Musculoskeletal review. Today's topic, osteoporosis. Let's take a look. So we'll start our talk on osteoporosis. The clinical scenario you will get will be an elderly patient, and you will need to determine if this person should be on a pharmacologic treatment for osteoporosis, and maybe a few details about those drugs. The first question is, at what age do you start screening? And that age is 65. At age 65, you undergo screening, and you screen with a DEXA scan. The DEXA scan will divide our patients into 3 categories: normal bone, osteopenic bone, osteopenic, and osteoporotic bone. Osteoporotic bone. The DEXA will give you what's called a T-score, and the T-score is a standard deviation, and the number you need to memorize is 2.5 or negative 2.5 to be more exact. The number between negative 1 and negative 2.5 will put you in the osteopenic category, and any worse score than that, so anything less than negative 2.5, is osteoporosis. The other important definition of osteoporosis is having a fragility fracture. So fragility fracture, because any fragility fracture will trump any T-score. So if I had to write a tricky test question, I would say patient has a T-score of 2.1, they have a hip fracture. Are they osteopenic, osteoporotic, or normal? The answer is osteoporotic, because any fragility fracture will trump the T-score. The 3 fragility fractures you need to know are the most common ones. First is a vertebral compression fracture. 2 is any hip fracture. And 3 is a distal radius fracture. So if you have a patient that has any of these fractures, they by definition have osteoporosis. All osteoporotics should start pharmacologic treatment. None of the normal ones meet indication for that, but which of the osteopenic ones? And that is another easily testable concept. If you have an osteopenic patient, what's the next step? The next step is to get what is called a FRAX score. FRAX score is a risk stratification that will determine the percentage chance that you will have a hip fracture or any other fragility fracture in the next 10 years. Essentially, if that percentage is elevated, you also should undergo pharmacologic treatment for osteoporosis. The rest, the osteopenics with no increased risks, and the normal bones don't need any kind of formal pharmacologic treatment. And to be clear, I don't mean vitamin D or calcium. Pretty much everyone in that age group should be on this, because there are very little side effects and it can actually do a lot of good. What I mean by pharmacologic treatment are the sort of heavy hitters. And the number one first line treatment you need to know, now that you know that a patient meets criteria, you need to, in the first class, is a bisphosphonate. These are the drugs: zoledronate, alendronate, anything that ends in dronate is going to be in the bisphosphonate class. And these are the first line medications. They work by decreasing your osteoclast activity. Osteoclasts, or osteoclast kill bone, and osteoblast build bone. And what is very testable are the side effects. So you need to monitor the side effects. The most common ones are the GI side effects. You can think of them like taking NSAIDs. So you can get gastric ulcers, esophagitis. The strange ones, they're rare but strange, and that screams testable, are osteonecrosis of the jaw, and atypical femur fractures. Atypical femur fractures. Now, by atypical, what we mean by that, it's a little bit unusual looking on the X-ray. I'm trying to draw the hip as best I can. Here's a hip. It's a femur bone, top of the femur bone. So a standard hip fracture has a certain pattern that we recognize very easily as orthopedic surgeons. Now, an atypical fracture, number one, is a little bit lower down. It's more distal, and it's got this little step off here that sticks out like a sore thumb when you're a surgeon. Again, that's what we mean by atypical. It's got sort of an atypical appearance on X-ray. The second important drug you need to know for osteoporosis is teriparatide. Actually is similar to parathyroid hormone. This should be a little confusing because parathyroid seems to do the opposite. Parathyroid actually will increase your osteoclast activity, but someone found out if you give this analog in a pulsatile manner, it actually does the opposite. So this actually does decrease osteoclasts. And the third drug class that you should know is denosumab. And anything that ends with mab is a monoclonal antibody, and this monoclonal antibody is for a ligand called a rank ligand, which starts this many-step cascade that will activate osteoclasts. So once again, this antibody will decrease osteoclastic activity. As a segue for bisphosphonates, which is quite interesting, bisphosphonates are the first line treatment for osteoporosis, but also osteoporosis. But it's also first line treatment for a disease called Paget's disease. Now they seem slightly random, but these diseases are actually very similar. They're both similar in that they both start by overactive osteoclasts. Now, if I had to draw a normal bone, the normal bone density would look something like this. Something like this as far as the density of the trabecular bone. Now, osteoporotics, if I had to draw their bone, it's less dense. They have less density. Paget's disease starts off that way. A lot of osteoclasts are going a little crazy. So the bone is not very dense at all. But then there's another stage in which it responds by really laying down a lot of very dense bone, actually a lot of increased osteoblastic activity. So you get what's called disordered bone. You get some areas that are very osteoporotic. You get some points that are very dense. So the x-rays look very patchy. They have some areas that are very sclerotic, some areas that are very osteoporotic. But either way, what you're trying to do is turn down this kind of crazy osteoclastic activity. What you're trying to do is turn down the volume. And that's what bisphosphonates are really good at doing. So that in a nutshell is what you need to know for osteoporosis. There are some little nuts and bolts like certain drugs that put you at risk for that. But you can go through that in your own notes. Hopefully this is helpful. I'll be making more videos for PANCE musculoskeletal review. Follow me for more videos.